Certified Emergency Nurse and Practice Exam. Question 1. Which of the following statements made by a patient would lead the nurse to conclude that the patient understands risk factors for pulmonary embolism? Here are the options. Option A. While on a long flight, I should get up and walk to stretch my legs every hour. Option B. Resuming my birth control pills will lower my risk of cancer and my risk of another clot. Option C. If I drink plenty of water while driving on a long trip, this shouldn't happen again. Option D. Switching from my regular cigarettes to the electronic ones can reduce my risk. The correct answer is option A. While on a long flight, I should get up and walk to stretch my legs every hour. The correct answer is while on a long flight, I should get up and walk to stretch my legs every hour. Question 2. An emergency nurse is providing discharge instructions for a patient with pelvic inflammatory disease. Which statement made by the patient indicates an understanding of these instructions? Here are the options. Option A. Getting pregnant shouldn't be a problem once the infection goes away. Option B. I'll take the medicine for nausea when I feel sick to my stomach. Option C. I will be at increased risk for ectopic pregnancy. Option D. I will follow up with my doctor tomorrow. The correct answer is option C. I will be at increased risk for ectopic pregnancy. The correct answer is I will be at increased risk for ectopic pregnancy. Question 3. A 16-year-old presents with severe left upper quadrant abdominal pain after an over-the-handlebars bicycle collision. Vital signs are blood pressure 160 millimeters of mercury, heart rate 100 beats per minute, respiratory rate 30 breaths per minute, T 37.0 degrees Celsius 98.6 degrees Fahrenheit, oxygen saturation 89% without supplemental oxygen. There is bruising over the left upper quadrant of the abdomen. Auscultation reveals diminished breath sounds on the left accompanied by gurgling. Based on this history and assessment, the nurse suspects which injury? Here are the options. Option A. Small bowel rupture. Option B. Ruptured diaphragm. Option C. Flailed chest. Option D. Hepatic injury. The correct answer is option B. Ruptured diaphragm. The correct answer is ruptured diaphragm. Question 4. A patient presents with chest pain. The nurse performs a 12-lead electrocardiogram that reveals an abnormal Q wave. What does the nurse suspect? Here are the options. Option A. A current injury. Option B. An old infarction. Option C. An acute infarction. Option D. Ischemia. The correct answer is option B. An old infarction. The correct answer is an old infarction. Question 5. A patient is brought to the emergency department by emergency medical services with increased aggression and making clear homicidal threats. What immediate action will the nurse expect to promote staff and patient safety? Here are the options. Option A. Administration of antipsychotics. Option B. One-to-one observation. Option C. Place in a seclusion room. Option D. Application of restraints. The correct answer is option C. Place in a seclusion room. The correct answer is place in a seclusion room. Question 6. A 28-year-old female presents with shortness of breath, dizziness, and diaphoresis. Her vital signs are blood pressure 118 and 74 millimeters of mercury, heart rate 122 beats per minute, respiratory rate 26 breaths per minute, T 37.7 degrees Celsius 99.9 degrees Fahrenheit, oxygen saturation 92% without supplemental oxygen. Her health history includes fractures of the left tibia and fibula following an MVC 3 weeks ago. Surgical fixation was required. Her only current medications are an oral contraceptive and intermittent ibuprofen for pain. Assessment of the casted left leg reveals that the toes are swollen. With this information, which diagnostic testing will the nurse expect as the highest priority? Here are the options. Option A, sputum cultures. Option B, chest radiograph. Option C, computed tomographic pulmonary angiography. Option D, radiograph of the left leg. The correct answer is option C, computed tomographic pulmonary angiography. The correct answer is computed tomographic pulmonary angiography. Question 7. A family of 10 presents to the emergency department with complaints of fever, muscle pain, and unexplained bruising ongoing for 7 days. After completing the screening, the nurse notes that the family recently traveled to Sierra Leone. What is the highest priority intervention the triage nurse needs to perform? Here are the options. Option A, notify infection prevention. Option B, leave the family in the waiting room. Option C, evacuate the waiting room. Option D, inform those waiting that Ebola has been detected. The correct answer is option A, notify infection prevention. The correct answer is notify infection prevention. Question 8. A patient presents to the emergency department with complaints of fatigue and insomnia. Assessment findings reveal the patient is awake, alert and oriented, has a round moon face, buffalo humpback, hirsutism and prominent stria on the trunk. Vital signs are normal. Which of the following scenarios is most consistent with this patient's presentation? Here are the options. Option A, a high school wrestler who admits to taking his grandfather's furosemide before a meet. Option B, a patient with insulin-dependent diabetes who took insulin without eating breakfast. Option C, a patient with severe chronic asthma who has been on prednisone for several years. Option D, a patient who underwent a thyroidectomy several years ago who recently ran out of medication. The correct answer is option C, a patient with severe chronic asthma who has been on prednisone for several years. The correct answer is a patient with severe chronic asthma who has been on prednisone for several years. Question 9. A patient who was brought to the emergency department by ambulance following a motor vehicle collision in which the driver hit a tree has blood pressure 92 and 48 millimeters of mercury, heart rate 128 beats per minute, respiratory rate 34 breaths per minute, oxygen saturation 91% with supplemental oxygen via a non-breather. He has labored breathing, cyanosis, absent breath sounds on the right, and jugular vein distension. Which of the following conditions would be suspected? Here are the options. Option A, aspiration. Option B, flail chest. Option C, cardiac tamponade. Option D, tension pneumothorax. The correct answer is option D, tension pneumothorax. The correct answer is tension pneumothorax. Question 10. What is the most common cause of cardiogenic shock? Here are the options. Option A. Sustained cardiac dysrhythmias. Option B. Acute valvular dysfunction. Option C. Myocardial infarction. Option D. End-stage cardiomyopathy. The correct answer is option C. Myocardial infarction. The correct answer is myocardial infarction. Question 11. The disease most commonly associated with the catarrhal, paroxysmal, and convalescent stages is best treated with classification of medications? Here are the options. Option A. Immune globulin. Option B. Steroids. Option C. Antiretroviral therapy. Option D. Macrolide antibiotics. The correct answer is option D. Macrolide antibiotics. The correct answer is macrolide antibiotics. Question 12. A 28-year-old female presents to the emergency department with complaints of dizziness, fear of dying, and hot flashes that began 10 minutes prior to arrival. The patient is trembling and tachypneic. Which anxiety disorder is the patient exhibiting? Here are the options. Option A. Post-traumatic stress disorder. Option B. Panic attack. Option C. Acute stress disorder. Option D. Generalized anxiety disorder. The correct answer is option B. Panic attack. The correct answer is panic attack. Question 13. A 30-year-old male presents to the emergency department with excruciating pain on the right side of his head. It has been coming and going all day. His right eye is reddened and skin is flushed. What type of headache is this patient experiencing? Here are the options. Option A. Tension. Option B. Traumatic. Option C. Cluster. Option D. Migraine. The correct answer is option C. Cluster. The correct answer is cluster. Question 14. To make certain that chain of custody has been followed appropriately, what is the most responsible task performed by the emergency nurse? Here are the options. Option A. Keep the evidence at their workstation until released to law enforcement. Option B. Sign and date the tamper-resistant tape in front of law enforcement. Option C. Limit the number of people with access to the evidence. Option D. Carry the evidence with them until released to law enforcement. The correct answer is option C. Limit the number of people with access to the evidence. The correct answer is limit the number of people with access to the evidence. Question 15. Which orthopedic condition is the result of elevated uric acid levels? Here are the options. Option A. Joint effusion. Option B. Osteomyelitis. Option C. Gouty arthritis. Option D. Bursitis. The correct answer is option C. Gouty arthritis. The correct answer is gouty arthritis. Question 16. A patient presents to the emergency department with sensory hallucinations and delusions. He also has disorganized speech and grossly disordered behavior. What would the nurse expect to take place in order for the patient to be properly cared for? Here are the options. Option A. A suicide risk assessment. Option B. Administration of antipsychotics. Option C. Application of restraints. Option D. Medical clearance. The correct answer is option D. Medical clearance. The correct answer is medical clearance. Question 17. A patient has just been diagnosed with endocarditis. While preparing for surgery for valvular repair, which intervention will the nurse perform? Here are the options. Option A. Insert a urinary catheter. Option B. Insert a gastric tube. Option C. Begin an infusion of nitroprusside. Option D. Administer antibiotics. The correct answer is option D. Administer antibiotics. The correct answer is administer antibiotics. Question 18. A patient has an unsteady gait, weakness, diminished sensation to the face and arms, and vision changes. These findings are most likely associated with neurological condition? Here are the options. Option A. Myasthenia gravis. Option B. Amyotrophic sclerosis. Option C. Multiple sclerosis. Option D. Parkinson's disease. The correct answer is option C. Multiple sclerosis. The correct answer is multiple sclerosis. Question 19. The emergency nurse knows that a patient who has experienced a severe electrical injury is at risk for which of the following? Here are the options. Option A. Arrhythmias. Option B. Carboxyhemoglobinemia. Option C. Tissue liquefaction. Option D. Hypocalcemia. The correct answer is option A. Arrhythmias. The correct answer is arrhythmias. Question 20. Which heart block is associated with a lengthening PR interval until a QRS complex is dropped? Here are the options. Option A. First degree. Option B. Second degree type Roman II. Option C. Third degree. Option D. Second degree type I. The correct answer is option D. Second degree type I. The correct answer is second degree type I. Question 21. Which of the following interventions would be appropriate for a patient who has been diagnosed with renal calculi? Here are the options. Option A. Apply ice to the flank area. Option B. Immediate surgical intervention. Option C. Administer antiemetics. Option D. Nothing by mouth status. The correct answer is option C. Administer antiemetics. The correct answer is administer antiemetics. Question 22. A 67-year-old male presents with sudden onset, sharp, stabbing pain in his chest, flank, and back. He states he's taken ibuprofen and sublingual nitroglycerin prescribed for his angina. There has been no relief. Assessment reveals he is slurring his words, there is a facial droop, and his grip strength is weaker on the right. Vital signs are blood pressure 108 and 86 millimeters of mercury, heart rate 96 beats per minute, respiratory rate 18 breaths per minute, T 37.0 degrees Celsius 98.6 degrees Fahrenheit, oxygen, saturation 91% without supplemental oxygen. What assessment can the nurse do to further determine the cause of these signs and symptoms? Here are the options. Option A. Take a blood pressure on the other arm. Option B. Send blood to the laboratory for toxicology. Option C. Perform an assessment for stroke. Option D. Send blood to the laboratory for cardiac enzymes. The correct answer is option A. Take a blood pressure on the other arm. The correct answer is take a blood pressure on the other arm. Question 23. A patient has just been diagnosed with diabetes insipidus. Which medication will the nurse expect to give? Here are the options. Option A, hypertonic saline. Option B, methylprednisolone. Option C, vasopressin. Option D, furosemide. The correct answer is option C, vasopressin. The correct answer is vasopressin. Question 24. A 56-year-old female presents with vague complaints of fatigue and bloating. Assessment reveals pitting edema of hands and feet, abdominal distension, and prominent neck veins. What condition is described by these clinical manifestations? Here are the options. Option A, myocardial infarction. Option B, aortic dissection. Option C, right-sided heart failure. Option D, left-sided heart failure. The correct answer is option C, right-sided heart failure. The correct answer is right-sided heart failure. Question 25. An emergency nurse is interviewing fellow staff nurses in order to understand how the emotional states of fatigued nurses impact outcomes of patients with behavioral health disorders. What type of research study is the nurse conducting? Here are the options. Option A, quantitative study. Option B, cohort study. Option C, randomized controlled trials. Option D, qualitative study. The correct answer is option D, qualitative study. The correct answer is qualitative study. Question 26. Which complication is associated with orbital wall fractures? Here are the options. Option A, trismus. Option B, development of mastoiditis. Option C, ocular entrapment. Option D, inability to protect one's own airway. The correct answer is option C, ocular entrapment. The correct answer is ocular entrapment. Question 27. What intervention is used to manage seasonal affective disorder? Here are the options. Option A, increasing caffeine intake. Option B, vitamin D supplements. Option C, moving to a warmer climate. Option D, use tanning beds. The correct answer is option B, vitamin D supplements. The correct answer is vitamin D supplements. Question 28. Which of the following would be indicative of Alzheimer's disease? Here are the options. Option A, gradual onset of memory loss and aphasia. Option B, sudden onset of disorganized speech and disorientation. Option C, acute onset of dysarthria and ataxia. Option D, chronic symptoms of sadness, slow speech, and flat affect. The correct answer is option A, gradual onset of memory loss and aphasia. The correct answer is gradual onset of memory loss and aphasia. Question 29. What is the best way to promote a successful family presence practice? Here are the options. Option A, ensure that social services leads the practice. Option B, allow immediate family to be present. Option C, have administrative support. Option D, make it a facility requirement. The correct answer is option C. Have administrative support. The correct answer is have administrative support. Question 30. A patient arrives unresponsive. Cardiopulmonary monitoring indicates a ventricular tachycardia. He has no pulse. What will the nurse anticipate as the next intervention? Here are the options. Option A. Synchronized cardioversion. Option B. Administer epinephrine intravenously. Option C. Administer atropine intravenously. Option D. Defibrillation. The correct answer is option D. Defibrillation. The correct answer is defibrillation. Question 31. What is a late sign of intussusception? Here are the options. Option A. Colicky pain. Option B. Ribbon-like stools. Option C. Left lower quadrant tenderness. Option D. Current jelly-like stools. The correct answer is option D. Current jelly-like stools. The correct answer is current jelly-like stools. Question 32. A patient presents with a sudden onset of shortness of breath, cough, and mild chest pain. Past medical history includes heart failure and recent treatment for pneumonia. Considering the patient's history, the nurse anticipates a workup for which respiratory problem? Here are the options. Option A. Chronic bronchitis. Option B. Pleural effusion. Option C. Pulmonary embolism. Option D. Pulmonary contusion. The correct answer is option B. Pleural effusion. The correct answer is pleural effusion. Question 33. A patient presents to the emergency department with right-sided facial drooping, right arm weakness, and slurred speech. Which of the following assessments indicates exclusion criteria for receiving tissue plasminogen activator? Tissue plasminogen activator. Here are the options. Option A. Blood glucose of 180 mg per deciliter. Option B. Blood pressure 190 and 110 mm of mercury. Option C. NIH stroke scale of 6. Option D. Headache. The correct answer is option B. Blood pressure 190 and 110 mm of mercury. The correct answer is blood pressure 190 and 110 mm of mercury. Question 34. A 16-year-old male is brought to the emergency department by his coach. The patient was playing football in moderately cold weather 1 hour prior to arrival and felt severe pain in the left groin area. This is suggestive of which genitourinary emergency? Here are the options. Option A. Paraphimosis. Option B. Testicular torsion. Option C. Priapism. Option D. Acute epididymitis. The correct answer is option B. Testicular torsion. The correct answer is testicular torsion. Question 35. A 3-year-old boy is brought to the emergency department by his mother, who noticed bruises on the boy's left thigh, back, and feet developing over the last week. Past medical history includes a mild respiratory virus a month ago. The assessment reveals he is awake and alert, with some bleeding noted around the gums. Initial laboratory values include a low platelet count with a normal white blood cell count. Hemoglobin and hematocrit are slightly low. Which disorder does the nurse suspect is the cause of his signs and symptoms? Here are the options. Option A. Leukemia. Option B. thrombocytosis. Option C, disseminated intravascular coagulopathy. Option D, idiopathic thrombocytopenia purpura. The correct answer is option D, idiopathic thrombocytopenia purpura. The correct answer is idiopathic thrombocytopenia purpura. Question 36. A 50-year-old male arrives at the emergency department via ambulance after sustaining a knife wound to the right side of his back. He has loss of movement on the right side and loss of sensation on the left side of his body. The nurse suspects that this is which type of spinal cord injury? Here are the options. Option A, Brown-Séquard syndrome. Option B, anterior cord syndrome. Option C, posterior cord syndrome. Option D, central cord syndrome. The correct answer is option A, Brown-Séquard syndrome. The correct answer is Brown-Séquard syndrome. Question 37. Each week, a community hospital emergency department employs key performance indicators to identify opportunities to enhance customer and staff satisfaction. This type of activity is a component of what? Here are the options. Option A, symptom surveillance. Option B, patient confidentiality. Option C, quality improvement. Option D, risk management. The correct answer is option C, quality improvement. The correct answer is quality improvement. Question 38. A 74-year-old presents to the emergency department with a history of chronic bronchitis and complaints of dyspnea and shortness of breath. He is cyanotic and the nurse supplies oxygen. Which of the following assessment findings will be most concerning to the nurse? Here are the options. Option A, a respiratory rate of 10 breaths per minute. Option B, an elevated hemoglobin. Option C, generalized edema. Option D, productive cough. The correct answer is option A, a respiratory rate of 10 breaths per minute. The correct answer is a respiratory rate of 10 breaths per minute. Question 39. A patient presents to the emergency department complaining of flu-like symptoms, malaise, and fever for 3 days after being bitten by a bat. The emergency nurse suspects which condition? Here are the options. Option A, tularemia. Option B, West Nile virus. Option C, rabies. Option D, Rocky Mountain spotted fever. The correct answer is option C, rabies. The correct answer is rabies. Question 40. An older adult patient arrives in the emergency department after she fell on her bathroom floor and was unable to get up. Knowing the patient was on the floor for a prolonged period of time, what clinical manifestation will the emergency nurse assess for? Here are the options. Option A, blood in the urine. Option B, dysuria. Option C, dark brown urine. Option D, anuria. The correct answer is option C, dark brown urine. The correct answer is dark brown urine. Question 41. A patient presents with ear pain, nausea, vomiting, vertigo, and tinnitus. The provider writes prescriptions for antibiotics, corticosteroids, and antiemetics. Which condition does this describe? Here are the options. Option A, labyrinthitis. Option B, ruptured tympanic membrane. Option C, Meniere's disease. Option D, otitis media. The correct answer is option A, labyrinthitis. The correct answer is labyrinthitis. Question 42. An adult patient complains of a papular, scaly, itchy rash that is most prominent in the webbing of the fingers, groin, and axilla. Permethrin cream has been prescribed. How will the nurse instruct the patient to apply the cream? Here are the options. Option A, to affected areas once per day for 3 days. Option B, from head to toe if the rash persists beyond a week. Option C, from head to toe with a second application 1 week later. Option D, to affected areas as needed for itching. The correct answer is option C, from head to toe with a second application 1 week later. The correct answer is from head to toe with a second application 1 week later. Question 43. A patient arrives in the emergency department with severe, sudden-onset chest pain. He states he used cocaine earlier that day and is taking a beta blocker for hypertension. Which abnormal assessment finding will the nurse expect? Here are the options. Option A, metabolic alkalosis. Option B, hypoglycemia. Option C, blood pressure 196 and 110 millimeters of mercury. Option D, heart rate 48 beats per minute. The correct answer is option C, blood pressure 196 and 110 millimeters of mercury. The correct answer is blood pressure 196 and 110 millimeters of mercury. Question 44. A mother brings her 3-week-old infant to the emergency department and states that the child throws up after eating and is immediately hungry again. This has been going on for over 1 week. The child is listless, with a capillary refill of greater than 2 seconds. Laboratory results reveal hypokalemia and metabolic alkalosis. Which intervention is the nurse's priority? Here are the options. Option A, oral replacement therapy. Option B, prepare for a barium enema. Option C, isotonic crystalloid fluid bolus. Option D, an antiemetic. The correct answer is option C, isotonic crystalloid fluid bolus. The correct answer is isotonic crystalloid fluid bolus. Question 45. When treating acute respiratory distress syndrome, which of the following interventions will the nurse expect to help maintain open alveoli? Here are the options. Option A, positive end expiratory pressure with ventilation. Option B, high tidal volumes with ventilation. Option C, aggressive fluid resuscitation. Option D, prophylactic antibiotic administration. The correct answer is option A, positive end expiratory pressure with ventilation. The correct answer is positive end expiratory pressure with ventilation. Question 46. A patient presents to the emergency department following an incident with an acid splash to the eye. He reports severe pain, is unable to open the eye, and there's constant tearing. What is the nurse's first priority? Here are the options. Option A, patch the affected eye. Option B, irrigation. Option C, visual acuity testing. Option D, test the eye for pH. The correct answer is option B, irrigation. The correct answer is irrigation. Question 47. A 22-year-old patient presents with upper respiratory symptoms, nausea and vomiting, and a low-grade fever. She has a history of leukemia and underwent chemotherapy 2 weeks ago. What is the nurse's priority? Here are the options. Option A. Protective isolation. Option B. Ondansetron oral dissolving tablet. Option C. Intravenous fluid bolus. Option D. Morphine intravenous. The correct answer is option A. Protective isolation. The correct answer is protective isolation. Question 48. A patient presents to the emergency department with the chief complaint of "it feels like I have something in my eye, but I can't see it." What eye injury is this most likely to represent? Here are the options. Option A. Corneal ulcer. Option B. Keratitis. Option C. Hyphema. Option D. Corneal abrasion. The correct answer is option D. Corneal abrasion. The correct answer is corneal abrasion. Question 49. In compensated shock, what physiological response increases serum sodium? Here are the options. Option A. Sympathetic nervous system response. Option B. Intracellular fluid shift. Option C. Renin-angiotensin-aldosterone system. Option D. Altered capillary permeability. The correct answer is option C. Renin-angiotensin-aldosterone system. The correct answer is renin-angiotensin-aldosterone system. Question 50. A patient describes symptoms of recent onset of eye pain and denies any traumatic injury. He is seeing halos around lights and is experiencing nausea, vomiting, and headaches. The nurse's assessment reveals loss of peripheral vision and redness of the affected eye. Which condition does this set of clinical manifestations describe? Here are the options. Option A. Acute angle glaucoma. Option B. Keratitis. Option C. Corneal ulcer. Option D. Retinal detachment. The correct answer is option A. Acute angle glaucoma. The correct answer is acute angle glaucoma. Question 51. Which of the following clinical presentations is most consistent with a patient who has pancreatitis? Here are the options. Option A. Pain with palpation of the right subcostal area during inspiration. Option B. Diffuse cramping abdominal pain. Option C. Epigastric pain that radiates to the back. Option D. Dull, constant umbilical pain. The correct answer is option C. Epigastric pain that radiates to the back. The correct answer is epigastric pain that radiates to the back. Question 52. Administration of activated charcoal is indicated for which of the following overdoses? Here are the options. Option A. Hydrofluoric acid. Option B. Carbamazepine. Option C. Ferrous sulfate. Option D. Lithium. The correct answer is option B. Carbamazepine. The correct answer is carbamazepine. Question 53. Which one of the following is an appropriate intervention for acute lithium toxicity? Here are the options. Option A. Intravenous fluids with hypertonic solution. Option B. Urine alkalinization. Option C. Hemodialysis. Option D. Give activated charcoal. The correct answer is option C. Hemodialysis. The correct answer is hemodialysis. Question 54. The level of alertness and attention displayed by a patient with a diffuse axonal injury is determined by which segment of the neurological system? Here are the options. Option A. Reticular activating system. Option B. Brainstem. Option C. Frontal lobe. Option D. Limbic system. The correct answer is option A. Reticular activating system. The correct answer is reticular activating system. Question 55. What is the first intervention that is appropriate for the nurse to perform once a neonate has been delivered? Here are the options. Option A. Thoroughly dry the neonate. Option B. Suction the mouth and nose. Option C. Measure Apgar score. Option D. Clamp the umbilical cord. The correct answer is option A. Thoroughly dry the neonate. The correct answer is thoroughly dry the neonate. Question 56. The nurse is giving discharge instructions to a patient with chronic obstructive pulmonary disease emphysema. Which response indicates the patient understands the instructions? Here are the options. Option A. I need to limit my fluids to prevent fluid overload. Option B. I need to sleep with my feet elevated to prevent swelling. Option C. I need to get the pneumococcal vaccine. Option D. I need to avoid snacking between meals. The correct answer is option C. I need to get the pneumococcal vaccine. The correct answer is I need to get the pneumococcal vaccine. Question 57. A patient who has suffered deep, full-thickness third-degree thermal burns to the circumferential chest and abdomen, as well as burns of varying depth to the upper extremities, has been transferred to your emergency department from a small, rural community hospital. Ventilating the intubated patient via bag mask device is becoming increasingly difficult, and chest rise with ventilation is poor. The emergency nurse anticipates which procedure? Here are the options. Option A. Tracheostomy. Option B. Cricothyroidotomy. Option C. Asherotomy. Option D. Fasciotomy. The correct answer is option C. Asherotomy. The correct answer is asherotomy. Question 58. A patient presents to the emergency department with disorientation to time, place and person, memory impairment, and personality changes for the past 6 days. This patient is most likely exhibiting which psychosocial emergency? Here are the options. Option A. Dementia. Option B. Schizophrenia. Option C. Depression. Option D. Delirium. The correct answer is option D. Delirium. The correct answer is delirium. Question 59. A patient arrives with complaints of shortness of breath and a history of asthma. The assessment reveals mild tachypnea, biphasic expiratory and inspiratory wheezing, and use of accessory muscles. Peak expiratory flow is 48% of personal best. What is the severity of this asthma exacerbation? Here are the options. Option A. Severe. Option B. moderate. Option C, slight. Option D, mild. The correct answer is option B, moderate. The correct answer is moderate. Question 60. A hazard vulnerability analysis was completed for a rural area emergency department. One finding was that the electrical system was antiquated and could not handle power outages with generator backup. The Director of Emergency Preparedness acknowledged this issue and initiated a plan to ensure that the electrical system received the necessary upgrades. What phase of disaster preparedness is this related to? Here are the options. Option A, mitigation. Option B, preparedness. Option C, response. Option D, recovery. The correct answer is option A, mitigation. The correct answer is mitigation. Question 61. A patient presents to the emergency department with complaints of right arm weakness and difficulty speaking. The symptoms started about 40 minutes ago and are now improving. She said this happened yesterday too, but went away. What is she experiencing? Here are the options. Option A, hemorrhagic stroke. Option B, ischemic stroke. Option C, Bell's palsy. Option D, transient ischemic attacks. The correct answer is option D, transient ischemic attacks. The correct answer is transient ischemic attacks. Question 62. A 37-year-old female walks into the emergency department holding her abdomen. She is writhing in pain. Her history includes vaginal bleeding for the past 6 days. She soaked 5 sanitary pads in 2 hours. What is the most likely cause of the heavy bleeding? Here are the options. Option A, uterine fibroids. Option B, Middleschmerz. Option C, pelvic inflammatory disease. Option D, Bartholin cyst. The correct answer is option A, uterine fibroids. The correct answer is uterine fibroids. Question 63. Wernicke-Korsakoff syndrome is characterized by which clinical manifestations? Here are the options. Option A, ataxia, mental confusion, and ophthalmoplegia. Option B, delirium tremens, hyperthermia, and disorientation. Option C, tachycardia, tremors, and tachypnea. Option D, hypothermia, muscle rigidity, and bradycardia. The correct answer is option A, ataxia, mental confusion, and ophthalmoplegia. The correct answer is ataxia, mental confusion, and ophthalmoplegia. Question 64. A 35-year-old man presents with complaints of stomach pain that comes and goes for the past 2 weeks. The nurse asks additional questions about the nature of this pain and finds that it is relieved with antacids and he feels better after eating. The patient mentions that he had some similar pain about 2 years ago, but it stopped after about a month and he never sought care for it. This is most likely which type of gastrointestinal disorder? Here are the options. Option A, cholecystitis. Option B, pancreatitis. Option C, duodenal ulcer. Option D, stress ulcer. The correct answer is option C, duodenal ulcer. The correct answer is duodenal ulcer. Question 65. Which immunoglobulin is responsible for type 1 allergic responses? Here are the options. Option immunoglobulin A. Option B immunoglobulin E. Option C immunoglobulin G. Option D immunoglobulin M. The correct answer is option B, immunoglobulin E. The correct answer is immunoglobulin E. Question 66. A middle-aged male patient presents to the emergency department with complaint of fever. He is awake, alert, and in no acute distress. On arrival, vital signs are blood pressure 118 and 58 millimeters of mercury, heart rate 112 beats per minute, respiratory rate 20 breaths per minute, oxygen saturation 95%, T 38.8 degrees Celsius 101.9 degrees Fahrenheit. His medical history includes human immunodeficiency virus hintravenous, and he is taking antiviral medications. Using a 5-level triage system, this patient would be triaged as which acuity level? Here are the options. Option A, acuity level 4 non-urgent. Option B, acuity level 2 emergent. Option C, acuity level 1 life-threatening situation. Option D, acuity level 3 urgent. The correct answer is option B, acuity level 2 emergent. The correct answer is acuity level 2 emergent. Question 67. An 84-year-old male with a decreased level of consciousness presents to the emergency department from a nursing home. The patient has a history of hypertension, gout, and chronic obstructive pulmonary disease. He is allergic to penicillin. Current medications include docusate, a poundcitrol inhaler, colchicine, and metoprolol. Vital signs on arrival are blood pressure 78 and 48 millimeters of mercury, heart rate 60 beats per minute, respiratory rate 28 breaths per minute, T 35.3 degrees Celsius 95.6 degrees Fahrenheit, and oxygen saturation 92% without supplemental oxygen. Which type of shock do these clinical manifestations represent? Here are the options. Option A, obstructive. Option B, septic. Option C, anaphylactic. Option D, hypovolemic. The correct answer is option B, septic. The correct answer is septic. Question 68. A 56-year-old female presents to the emergency department with complaints of abdominal pain for 5 days. The patient was involved in a motor vehicle crash, but did not feel that she needed to come to the emergency department. Upon examination, the patient has no active bowel sounds and the abdomen is rigid. The patient has which gastrointestinal emergency? Here are the options. Option A, peritonitis. Option B, diverticulitis. Option C, intestinal obstruction. Option D, esophageal obstruction. The correct answer is option A, peritonitis. The correct answer is peritonitis. Question 69. A patient who was successfully defibrillated now has an irregular rhythm at 86 beats per minute. The patient remains unresponsive with absent central pulses. These findings are associated with which condition? Here are the options. Option A, ruptured aortic aneurysm. Option B, pulseless electrical activity. Option C, pericardial tamponade. Option D, coarse ventricular fibrillation. The correct answer is option B, pulseless electrical activity. The correct answer is pulseless electrical activity. Question 70. An adolescent playing basketball felt a pop in her heel after a jump shot and a sharp pain in her heel as she landed. She is unable to stand on the ball of her foot. Which injury do these clinical manifestations most likely represent? Here are the options. Option A. Calcaneus fracture. Option B. Achilles tendon rupture. Option C. Ankle strain. Option D. Metatarsal fracture. The correct answer is option B. Achilles tendon rupture. The correct answer is Achilles tendon rupture. Question 71. A patient arrives after getting a hand caught in a machine, peeling the skin away and exposing underlying structures. What injury does this represent? Here are the options. Option A. Hematoma. Option B. Avulsion. Option C. Laceration. Option D. Abrasion. The correct answer is option B. Avulsion. The correct answer is avulsion. Question 72. The nurse is providing discharge instructions to a patient with asthma. Which of the following statements indicates understanding from the patient? Here are the options. Option A. I should avoid air conditioning if I begin having symptoms. Option B. I'm going to wash my bed linen once a week in hot water. Option C. To get a baseline peak expiratory flow, I'll do it right before I use my inhaler. Option D. My son uses a spacer, but since I'm an adult and can coordinate the inhaler, I don't need one. The correct answer is option B. I'm going to wash my bed linen once a week in hot water. The correct answer is I'm going to wash my bed linen once a week in hot water. Question 73. Discharge instructions are given to a patient with a prescription for phenazopyridine. Which statement by the patient indicates an understanding of the medication side effects? Here are the options. Option A. My urine will have an orange discoloration. Option B. I can continue to take it even if I develop a rash. Option C. This medication does not have any side effects. Option D. I may gain weight while taking this medication. The correct answer is option A. My urine will have an orange discoloration. The correct answer is my urine will have an orange discoloration. Question 74. A patient presents to the emergency department stating he had been hit in the right eye with a glass bottle 2 days ago. On assessment, the eye is reddened, tearing, and there is an irregular pupil. Which ocular emergency is associated with these assessment findings? Here are the options. Option A. Retinal detachment. Option B. Hyphema. Option C. Foreign body. Option D. Iritis. The correct answer is option D. Iritis. The correct answer is iritis. Question 75. A patient presents to the emergency department with complaints of feeling guilty and sad. He also has had decreased appetite and sleep disturbances for the past 3 weeks. What intervention is priority for this patient? Here are the options. Option A. Performing a suicide risk assessment. Option B. Placing patient in a low stimulus area. Option C. Administering antidepressants or anxiolytics. Option D. Providing a discharge referral for support services. The correct answer is option A. Performing a suicide risk assessment. The correct answer is performing a suicide risk assessment. Question 76. An emergency department patient is being prepared for surgical intervention for a large bowel obstruction. The surgeon needs to obtain a signature for informed consent. The patient is unable to sign the consent form because of having been heavily sedated. Which advance directive allows for a family member to sign the consent form? Here are the options. Option A. Durable power of attorney for finance. Option B. Living will. Option C. Do not resuscitate order. Option D. Durable power of attorney for healthcare. The correct answer is option D. Durable power of attorney for healthcare. The correct answer is durable power of attorney for healthcare. Question 77. A male patient arrives following a motor vehicle collision. Emergency medical services report vital signs: heart rate 92 beats per minute, respiratory rate 20 breaths per minute, blood pressure 128 and 74 millimeters of mercury, oxygen saturation 96% with a non-rebreather at 15 liters per minute. They state that the airbag malfunctioned and he hit the steering wheel. The nurse assesses the patient and finds bruising to the sternum, muffled heart tones, and the following vital signs: heart rate 102 beats per minute, respiratory rate 18 breaths per minute, blood pressure 122 and 94 millimeters of mercury, oxygen saturation 92%. What pathophysiologic process does the nurse recognize? Here are the options. Option A. Low pulse pressure. Option B. Decrease in afterload. Option C. High pulse pressure. Option D. Cushing triad. The correct answer is option A. Low pulse pressure. The correct answer is low pulse pressure. Question 78. Which inherited bleeding disorder is the most common? Here are the options. Option A. Von Willebrand. Option B. Classic hemophilia. Option C. Christmas disease. Option D. Rosenthal syndrome. The correct answer is option A. Von Willebrand. The correct answer is von Willebrand. Question 79. Which complication is the most common risk for all puncture wounds? Here are the options. Option A. Joint effusion. Option B. Osteomyelitis. Option C. Abscess. Option D. Hemorrhage. The correct answer is option C. Abscess. The correct answer is abscess. Question 80. A patient presents with vaginal bleeding and cramping. She tells the emergency nurse, "I passed clots at home. I think I lost my baby." Pelvic examination reveals that the cervical OS is open. Which type of spontaneous abortion most likely occurred? Here are the options. Option A. Missed abortion. Option B. Septic abortion. Option C. Inevitable abortion. Option D. Threatened abortion. The correct answer is option C. Inevitable abortion. The correct answer is inevitable abortion. Question 81. The nurse practitioner ordered a procalcitonin to be drawn on a patient. This will identify which condition. Here are the options. Option A. Parathyroid disease. Option B. Hyperosmolar hyperglycemic syndrome. Hyperosmolar hyperglycemic syndrome. Option C. Tuberculosis. Option D. Sepsis. The correct answer is option D. Sepsis. The correct answer is sepsis. Question 82. A patient presents with a sore throat and difficulty swallowing. Assessment reveals fever, muffled voice, and cervical lymphadenitis. What is the highest priority? Here are the options. Option A, airway protection. Option B, pain management. Option C, preparation for incision and drainage. Option D, intravenous access for fluid resuscitation. The correct answer is option A, airway protection. The correct answer is airway protection. Question 83. A 42-year-old female patient presents to the emergency department with complaints of having right upper quadrant cramping pain that radiates to the right scapula and shoulder areas. She also complains of being bloated and passing gas. With her history, which gastrointestinal disorder is she at risk for? Here are the options. Option A, cholecystitis. Option B, hepatitis. Option C, pancreatitis. Option D, diverticulitis. The correct answer is option A, cholecystitis. The correct answer is cholecystitis. Question 84. A patient presents to the emergency department with chest pain. The nurse assesses the pain and determines that rest relieves the pain. What does the nurse determine this indicates? Here are the options. Option A, stable angina. Option B, unstable angina. Option C, non-ST elevation myocardial infarction. Option D, ST elevation myocardial infarction. The correct answer is option A, stable angina. The correct answer is stable angina. Question 85. A 32-year-old female patient is brought to the emergency department via emergency medical services with a complaint of coughing for the past 2 weeks. The patient is now complaining of severe epigastric pain and is violently retching and vomiting blood. She has a history of alcohol abuse and bulimia. Which type of gastrointestinal disorder is the most likely cause of these symptoms? Here are the options. Option A, diverticulitis. Option B, Mallory-Weiss syndrome. Option C, pancreatitis. Option D, gastric ulcer. The correct answer is option B, Mallory-Weiss syndrome. The correct answer is Mallory-Weiss syndrome. Question 86. Which stage pressure ulcer includes partial thickness skin loss? Here are the options. Option A, stage 2. Option B, stage 1. Option C, stage 3. Option D, stage 4. The correct answer is option A, stage 2. The correct answer is stage 2. Question 87. The Frank-Starling law applies to which component of cardiac output? Here are the options. Option A, stroke volume. Option B, preload. Option C, heart rate. Option D, afterload. The correct answer is option B, preload. The correct answer is preload. Question 88. Which of the following is an early sign of increasing intracranial pressure in a patient with a head injury? Here are the options. Option A, bradycardia. Option B, widening pulse pressure. Option C, extension of upper extremities with stimuli. Option D, nausea and vomiting. The correct answer is option D, nausea and vomiting. The correct answer is nausea and vomiting. Question 89. A patient arrives via emergency medical services and is unresponsive, pale, and with involuntary movement of the head and right side of the body. Symptoms continue despite midazolam having been administered in the field. Which medication should be administered next? Here are the options. Option A, thiamine. Option B, phosphonatine. Option C, phenobarbital. Option D, lorazepam. The correct answer is option D, lorazepam. The correct answer is lorazepam. Question 90. A 23-year-old patient with a stable ectopic pregnancy is being cared for by an emergency nurse. The emergency physician ordered methotrexate to be administered intramuscularly. Which statement by the nurse indicates an understanding of the medication? Here are the options. Option A, I'll instruct the patient to follow up in 2 weeks. Option B, I can give this medication because there is only scant vaginal bleeding. Option C, I'll give this medication because there is fetal cardiac activity. Option D, I can't administer this medication. I'm pregnant. The correct answer is option D, I can't administer this medication. I'm pregnant. The correct answer is I can't administer this medication. I'm pregnant. Question 91. The nurse is giving discharge instructions to a patient with Bell's palsy. Which of the following will be included? Here are the options. Option A, avoid sleeping on the affected side. Option B, instill artificial tears during the day. Option C, take antibiotics as prescribed. Option D, use a mouthguard at night. The correct answer is option B, instill artificial tears during the day. The correct answer is instill artificial tears during the day. Question 92. Meningeal irritation in a 26-year-old patient is considered after which one of the following assessment findings? Here are the options. Option A, positive Babinski. Option B, natural rigidity. Option C, abnormal flexion. Option D, negative Brodzinski sign. The correct answer is option B, natural rigidity. The correct answer is natural rigidity. Question 93. A mass casualty incident occurred near a level 1 trauma center. There were several deaths ranging from ages 3 months to 42 years old. The nurses working that night were emotionally drained and physically stressed. A critical incident process was arranged within 24 hours. Which component of the critical incident stress management process took place? Here are the options. Option A, debriefing. Option B, diffusing. Option C, crisis intervention. Option D, follow-up. The correct answer is option A, debriefing. The correct answer is debriefing. Question 94. An infant with a history of hydrocephalus presents with a bulging anterior fontanelle, vomiting, poor feeding, and irritability. What condition do these clinical manifestations likely represent? Here are the options. Option A, malrotation with volvulus. Option B, pyloric stenosis. Option C. Ventriculoperidonal shunt malfunction. Option D. Meningococcemia. The correct answer is option C. Ventriculoperidonal shunt malfunction. The correct answer is ventriculoperidonal shunt malfunction. Question 95. A 68-year-old woman presents with a chief complaint of fatigue and exhaustion. She states she nearly passed out that morning and just has no energy. She states she's nauseous, but thinks it's because she's a little dizzy from almost passing out. She is overweight and has a history of smoking for 40 years, but quit 5 years ago. The nurse's assessment reveals mild tachypnea and diaphoresis. What will be the priority diagnostic assessment for this patient? Here are the options. Option A. Coagulation panel. Option B. Depression screening. Option C. Complete blood count with differential. Option D. Electrocardiogram. The correct answer is option D. Electrocardiogram. The correct answer is electrocardiogram. Question 96. A multiple trauma patient with rib fractures, a small, simple pneumothorax, and fractures of the tibia and fibula is being transferred by rotor wing helicopter to a facility that provides a higher level of care. What is considered prior to transport by this mode? Here are the options. Option A. Ensure that fluids are infusing by gravity. Option B. Chest tube is placed. Option C. Air splint is applied properly. Option D. Insert a urinary catheter. The correct answer is option B. Chest tube is placed. The correct answer is chest tube is placed. Question 97. Which one of the following is a significant risk factor for a patient wanting to attempt suicide? Here are the options. Option A. History of past attempts. Option B. Age between 25 and 35 years. Option C. Winter months. Option D. Acute physical illness. The correct answer is option A. History of past attempts. The correct answer is history of past attempts. Question 98. A 21-year-old female presents to the emergency department with complaints of pelvic pain. What possible cause of the pain is assessed for first? Here are the options. Option A. Urinary tract infection. Option B. Ectopic pregnancy. Option C. Ruptured ovarian cyst. Option D. Kidney stones. The correct answer is option B. Ectopic pregnancy. The correct answer is ectopic pregnancy. Question 99. The emergency nurse is giving discharge instructions to a patient who has just had a laceration closed with wound glue. Which statement indicates the patient understands the instructions? Here are the options. Option A. I should use sunscreen tomorrow when I go outside. Option B. I'll watch for it to slough off in the next 2 days. Option C. I should keep it covered with a bandage. Option D. I should look for redness or drainage. The correct answer is option D. I should look for redness or drainage. The correct answer is I should look for redness or drainage. Question 100. The nurse is reviewing laboratory results in a patient who presents with hyperglycemia. Which of the following statements about the difference between diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome is true? Here are the options. Option A. The patient with hyperosmolar hyperglycemic syndrome presents with a more significant acidosis than the patient with diabetic ketoacidosis. Option B. The patient with diabetic ketoacidosis presents with ketones in the urine, and the patient with hyperosmolar hyperglycemic syndrome does not. Option C. The patient with diabetic ketoacidosis presents with a higher blood glucose level than the patient with hyperosmolar hyperglycemic syndrome. Option D. Diabetic ketoacidosis. Diabetic ketoacidosis is a more common presentation in patients with type 1 diabetes mellitus, while hyperosmolar hyperglycemic syndrome is more common in patients with type 2 diabetes mellitus. The correct answer is option B. The patient with diabetic ketoacidosis presents with ketones in the urine, and the patient with hyperosmolar hyperglycemic syndrome does not. The correct answer is the patient with diabetic ketoacidosis presents with ketones in the urine, and the patient with hyperosmolar hyperglycemic syndrome does not. Question 101. The licensed provider orders a medication that the patient has a known allergy to. The nurse mistakenly administers the medication to the patient. Which ethical principle did the nurse breach? Here are the options. Option A. Justice. Option B. Non-maleficence. Option C. Beneficence. Option D. Autonomy. The correct answer is option B. Non-maleficence. The correct answer is non-maleficence. Question 102. A patient presents with an amputated thumb after an incident with a power saw. The nurse is readying the patient for transport to a trauma center for replantation. Which of the following represents a step in preparation of the amputated part? Here are the options. Option A. Cleanse with iodine. Option B. Irrigate with distilled water. Option C. Wrap in saline-soaked gauze. Option D. Place the part in iced saline. The correct answer is option C. Wrap in saline-soaked gauze. The correct answer is wrap in saline-soaked gauze. Question 103. Which term refers to a complete disruption of the articulating surface of the joint? Here are the options. Option A. Dislocation. Option B. Subluxation. Option C. Sprain. Option D. Strain. The correct answer is option A. Dislocation. The correct answer is dislocation. Question 104. Which cranial nerves are responsible for airway protection and speech? Here are the options. Option A. Roman 3, intravenous, VI. Option B. V, Roman 8, Roman 7. Option C. I, Roman 2, Roman 11. Option D. Roman 9, X, Roman 12. The correct answer is option D. Roman 9, X, Roman 12. The correct answer is Roman 9, X, Roman 12. Question 105. An adult male presents to the emergency department complaining of pain to the fingers of his right hand after using rust remover containing hydrofluoric acid earlier in the day. He states the pain began about 30 minutes ago. The distal digits are discolored and painful, but the fingernails are intact. After decontaminating the patient with copious amounts of water, the emergency nurse anticipates application of which treatment to the affected areas? Here are the options. Option A. Calcium gluconate gel to the affected areas. Option B. A topical fat emollient to the affected areas. Option C. calcium chloride gel to the affected areas. Option D. Ice directly to the affected areas. The correct answer is option A. Calcium gluconate gel to the affected areas. The correct answer is calcium gluconate gel to the affected areas. Question 106. What is the mode of transmission for the multidrug-resistant organism vancomycin-resistant Enterococcus? Here are the options. Option A. Blood and body fluid. Option B. Direct contact. Option C. Respiratory droplets. Option D. Airborne particles. The correct answer is option B. Direct contact. The correct answer is direct contact. Question 107. A 13-year-old presents to the emergency department. His parents state that he passed out at home and had been vomiting and had diarrhea for the last few days. He answers questions appropriately, although he complains of dizziness. His vital signs on arrival: blood pressure 70 and 40 millimeters of mercury, heart rate 132 beats per minute, respiratory rate 24 breaths per minute, T 36.9 degrees Celsius 98.4 degrees Fahrenheit, and oxygen saturation 97% without supplemental oxygen. A new graduate nurse inserted an intravenous line and is about to begin a fluid bolus of 5% dextrose in water. What does the preceptor explain to the new graduate nurse regarding fluid resuscitation? Here are the options. Option A. Because of the electrolyte disturbances from vomiting and diarrhea, use 5% dextrose and 0.45% sodium chloride. Option B. Because the patient is likely in septic shock, the fluid resuscitation is done slowly. Option C. The appropriate fluid for hypotension is isotonic crystalloid, not 5% dextrose in water. Option D. As a pediatric patient, 5% dextrose in water fluid is given at a bolus rate of 20 milliliters in kilograms. The correct answer is option C. The appropriate fluid for hypotension is isotonic crystalloid, not 5% dextrose in water. The correct answer is the appropriate fluid for hypotension is isotonic crystalloid, not 5% dextrose in water. Question 108. An 11-month-old patient presents to the emergency department with grunting, nasal flaring, copious nasal secretions, mild intercostal retractions, and expiratory wheezing. Vital signs include blood pressure 78 and 54 millimeters of mercury, heart rate 148 beats per minute, respiratory rate 74 breaths per minute, T 37.8 degrees Celsius 100.0 degrees Fahrenheit, oxygen saturation 93% without supplemental oxygen. Which intervention will be the nurse's highest priority? Here are the options. Option A. Give a bolus of normal saline. Option B. Prepare for intubation. Option C. Administer antibiotics. Option D. Suction the nares. The correct answer is option D. Suction the nares. The correct answer is suction the nares. Question 109. Which of the following statements is most significant when assessing a patient for Guillain-Barré syndrome? Here are the options. Option A. My mother says I have been forgetful. Option B. Both of my legs really hurt at night. Option C. I have lost control of my bladder a few times. Option D. My eye twitches a lot lately. The correct answer is option B. Both of my legs really hurt at night. The correct answer is both of my legs really hurt at night. Question 110. A patient with chest pain has an electrocardiogram that reveals ST segment elevation in diffuse leads and no reciprocal changes. The patient feels better sitting forward. Which is the most likely condition this patient is experiencing? Here are the options. Option A, pulmonary embolism. Option B, endocarditis. Option C, unstable angina. Option D, pericarditis. The correct answer is option D, pericarditis. The correct answer is pericarditis. Question 111. An 83-year-old female patient with a 2-day history of vomiting and diarrhea is brought to the emergency department via ambulance from a nursing home. The patient does not respond to verbal stimuli. Pitting edema is noted to both lower extremities. Her vital signs are as follows: blood pressure 85 and 45 millimeters of mercury, heart rate 38 beats per minute, respiratory rate 28 breaths per minute, and oxygen saturation 96% with oxygen at 15 liters per minute on non-rebreather mask. Which type of shock is displayed in this patient's presentation? Here are the options. Option A, obstructive shock. Option B, uncompensated shock. Option C, compensated shock. Option D, distributive shock. The correct answer is option B, uncompensated shock. The correct answer is uncompensated shock. Question 112. Following a motorcycle collision, a 20-year-old male was transported to the emergency department via emergency medical services. Upon assessment, blood is observed at the urinary meatus. What is an appropriate intervention for this patient? Here are the options. Option A, insert an indwelling urinary catheter. Option B, infuse isotonic crystalloid boluses to increase urinary output. Option C, obtain a urine specimen for analysis. Option D, obtain a surgical consult. The correct answer is option D, obtain a surgical consult. The correct answer is obtain a surgical consult. Question 113. A patient arrives in the emergency department with a complaint of having nausea and vomiting for 6 days. After the patient is registered for the visit, he is placed in a treatment room. The nurse explains the plan of care and the patient holds his arm out in preparation for blood specimen collection and intravenous line insertion. Which type of consent for treatment is this? Here are the options. Option A, implied. Option B, involuntary. Option C, informed. Option D, express. The correct answer is option D, express. The correct answer is express. Question 114. A patient is brought to the emergency department after a car he was working on fell and trapped his leg. The skin of the extremity is tight and pale. He reports the pain is 10 under a 10 scale. The peripheral pulses are normal and he has full range of motion, but it hurts. Which intervention will the nurse perform first? Here are the options. Option A, send the patient for limb radiographs. Option B, position the extremity at the level of the heart. Option C, splint the extremity in a neutral position. Option D, prepare the patient for a fasciotomy. The correct answer is option B, position the extremity at the level of the heart. The correct answer is position the extremity at the level of the heart. Question 115. The emergency nurse is caring for an 11-month-old child found unresponsive and apneic, face down in a bucket of water. The child received rescue breaths and had rapid return of respirations and is now awake, with normal vital signs. The nurse should anticipate which of the following. Here are the options. Option A. Early endotracheal intubation for preservation of airway. Option B. Prophylactic anticonvulsant medication. Option C. Close observation for a minimum of 24 hours. Option D. Radiographic imaging of the patient's spine. The correct answer is option C. Close observation for a minimum of 24 hours. The correct answer is close observation for a minimum of 24 hours. Question 116. A homeless patient is transported to the emergency department by Emergency Medical Services EMS in the middle of winter, complaining of numbness and tingling to his distal fingers and toes, which are now whitish with a waxy appearance. What is an appropriate method for rewarming? Here are the options. Option A. Immerse the affected areas in circulating warm water. Option B. Passively rewarm the affected area by warming the environment. Option C. Actively rewarm the affected area by infusion of warm intravenous solutions. Option D. Massage the affected areas until warm. The correct answer is option A. Immerse the affected areas in circulating warm water. The correct answer is immerse the affected areas in circulating warm water. Question 117. Caregivers bring their 2-year-old son to the emergency department with suspected foreign body ingestion. He was found playing with a box of buttons. Vital signs are blood pressure 92 and 54 millimeters of mercury, heart rate 134 beats per minute, respiratory rate 24 breaths per minute, T 37.0 degrees Celsius 98.6 degrees Fahrenheit, oxygen, saturation 99% without supplemental oxygen. There are no retractions or increased work of breathing, but he does cough with inspiration. He is able to talk. His breath sounds are diminished, with expiratory wheezing on the right. The left breath sounds are clear. Which intervention will the nurse prepare for? Here are the options. Option A. Endoscopic removal. Option B. The Heimlich maneuver. Option C. Manual removal. Option D. Direct laryngoscopy with forceps. The correct answer is option A. Endoscopic removal. The correct answer is endoscopic removal. Question 118. A child presents complaining of difficulty urinating. In triage, the mother begins speaking in Spanish. There is an adolescent sibling who begins to translate for his mother. Which of the following is the most effective nursing intervention to complete the patient assessment? Here are the options. Option A. Ask a Spanish-speaking bilingual nurse to translate. Option B. Allow the sibling to continue translating. Option C. Access an internet translation service to type in questions. Option D. Use the hospital phone translation services. The correct answer is option D. Use the hospital phone translation services. The correct answer is use the hospital phone translation services. Question 119. For a dark-skinned patient, which technique effectively assesses for early jaundice? Here are the options. Option A. Assess the stool for clay discoloration. Option B. Observe for yellow discoloration of the palate. Option C. Blanch the skin over the sternum and assess for yellow discoloration. Option D. Depress the nape pounced and observe for yellow discoloration. The correct answer is option B. Observe for yellow discoloration of the palate. The correct answer is observe for yellow discoloration of the palate. Question 120. A patient is transported to the emergency department via emergency medical services (EMS) with an oxygen saturation of 87%, hypotension, and seizures after being removed from a confined space in a burning industrial plant that manufactures plastic toys. What poisoning does the emergency nurse suspect? Here are the options. Option A. Carbon monoxide. Option B. Organophosphate. Option C. Insecticide. Option D. Cyanide. The correct answer is option D. Cyanide. The correct answer is cyanide. Question 121. An 8-year-old boy with a history of sickle cell disease presents with right knee pain that he rates at 8 out of 10 on the numeric scale. He denies history of recent injury. There is no redness or swelling at the site. The knee is tender to light palpation, but it radiates no heat to touch. The nurse anticipates the use of which of the following pharmacological agents? Here are the options. Option A. Morphine. Option B. Meperidine. Option C. Fentanyl. Option D. Ibuprofen. The correct answer is option A. Morphine. The correct answer is morphine. Question 122. A 68-year-old male presents to the emergency department with a complaint of increasing confusion over the past week after he tripped and fell, hitting his head. What type of brain injury is suspected? Here are the options. Option A. Mild traumatic brain injury. Option B. Epidural hematoma. Option C. Subdural hematoma. Option D. Basilar skull fracture. The correct answer is option C. Subdural hematoma. The correct answer is subdural hematoma. Question 123. Bilevel positive airway pressure. Bilevel positive airway pressure can be an ideal therapy to use on a respiratory failure patient with which associated assessment finding? Here are the options. Option A. Absent gag reflex. Option B. Nasal deformity. Option C. Distended neck veins. Option D. Excessive oral secretions. The correct answer is option C. Distended neck veins. The correct answer is distended neck veins. Question 124. Which assessment finding indicates magnesium toxicity in a patient with preeclampsia who is receiving a magnesium sulfate infusion? Here are the options. Option A. Shortness of breath. Option B. Hyperactive patellar reflexes. Option C. Elevated liver function tests. Option D. Decreased urinary output. The correct answer is option A. Shortness of breath. The correct answer is shortness of breath. Question 125. An emergency nurse knows that quality cardiopulmonary resuscitation in a neonate is achieved by? Here are the options. Option A. Hyperventilating the neonate to improve oxygenation. Option B. Rotating persons that perform chest compressions every 4 minutes. Option C. Beginning resuscitation with 100% oxygen. Option D. Performing chest compressions with minimal interruptions. The correct answer is option D. Performing chest compressions with minimal interruptions. The correct answer is performing chest compressions with minimal interruptions. Question 126. A 20-year-old male presents with a sudden onset of pleuritic chest pain, mild dyspnea, and a cough. Assessment reveals a tall, thin patient with tachycardia and diminished breath sounds on the right side. What thoracic condition is the most likely cause? Here are the options. Option A. Spontaneous pneumothorax. Option B. Open pneumothorax. Option C. Tension pneumothorax. Option D. Hemothorax. The correct answer is option A. Spontaneous pneumothorax. The correct answer is spontaneous pneumothorax. Question 127. Which of the following techniques is the most effective way to determine homicidal ideation? Here are the options. Option A. Inquire about the patient's interaction with family members and friends. Option B. Ask the patient about plans to carry out violence and any prohibiting factors. Option C. Observe the patient for threatening statements, movements, or actions. Option D. Be aware of any threatening feelings experienced while interacting with the patient. The correct answer is option B. Ask the patient about plans to carry out violence and any prohibiting factors. The correct answer is ask the patient about plans to carry out violence and any prohibiting factors. Question 128. A patient presents with a positive purified protein derivative test that was administered 2 days ago. She has no other symptoms. Which isolation precautions will the nurse initiate? Here are the options. Option A. Contact. Option B. Standard. Option C. Airborne. Option D. Droplet. The correct answer is option B. Standard. The correct answer is standard. Question 129. Which intervention is a priority for a patient with a retinal detachment? Here are the options. Option A. Bilateral eye patching. Option B. Warm compresses. Option C. Immediate irrigation. Option D. Antibiotic therapy. The correct answer is option A. Bilateral eye patching. The correct answer is bilateral eye patching. Question 130. A 32-year-old female patient presents to the emergency department with complaints of abdominal pain that is 10 out of 10 on a numeric rating scale. A pregnancy test is negative. A computed tomography scan of the abdomen has been ordered. The physician wants to hold analgesia until the computed tomography is completed. As an advocate for the patient, what might the emergency nurse do in this situation? Here are the options. Option A. Request an order for an opioid. Option B. Request an order for a non-opioid. Option C. Have the patient use distraction techniques. Option D. Have the patient use deep breathing. The correct answer is option A. Request an order for an opioid. The correct answer is request an order for an opioid. Question 131. A patient presents to the emergency department with superficial reddened welts to the hands and upper extremities incurred after placing his hands and arms into the jellyfish tank at the local zoo. After irrigating the wounds with normal saline and removing the tentacles with forceps, what is the best treatment for pain management? Here are the options. Option A. Application of a fat emollient. Option B. Application of a pressure bandage. Option C. Application of topical antihistamines. Option D. Application of acetic acid. The correct answer is option D. Application of acetic acid. The correct answer is application of acetic acid. Question 132. A 58-year-old male arrives to the emergency department following a motor vehicle collision. Assessment reveals bony crepitus and bruising over the left chest with paradoxical chest wall movement. He complains that it is difficult to breathe and his chest hurts. His vital signs are blood pressure 118 and 60 millimeters of mercury, heart rate 110 beats per minute, respiratory rate 32 breaths per minute, and shallow, T 37.0 degrees Celsius 98.6 degrees Fahrenheit oxygen, saturation 95% with 15 liters per minute via non-rebreather mask. The nurse will prepare for which priority intervention? Here are the options. Option A. Portable chest radiograph. Option B. 12-lead electrocardiogram. Option C. Chest tube insertion. Option D. Intubation with positive end expiratory pressure. The correct answer is option D. Intubation with positive end expiratory pressure. The correct answer is intubation with positive end expiratory pressure. Question 133. A patient arrives via emergency medical services and is unresponsive, pale, and with involuntary movements on the right side of body. Symptoms continue despite midazolam having been administered in the field. What is the priority intervention for this patient? Here are the options. Option A. Endotracheal intubation. Option B. Airway protection. Option C. Computed tomography scan. Option D. Phenytoin level. The correct answer is option B. Airway protection. The correct answer is airway protection. Question 134. A 12-year-old male is brought to the emergency department by his mother with complaints of difficulty breathing, swollen eyes and lips, and hives. The mother states that the child had just finished eating a peanut butter cookie. Epinephrine was administered. What is the next class of medications to be administered to the patient? Here are the options. Option A. Inhaled beta-2 agonist. Option B. Corticosteroid. Option C. Antihistamine. Option D. Anticholinergic. The correct answer is option A. Inhaled beta-2 agonist. The correct answer is inhaled beta-2 agonist. Question 135. Elevation of the head of the bed, but not the affected extremity, ambulation as tolerated, and thrombolytic therapy are interventions for which type of peripheral vascular disease? Here are the options. Option A. Lymphedema. Option B. Peripheral artery disease. Option C. Deep vein thrombosis. Option D. Peripheral venous disease. The correct answer is option B. Peripheral artery disease. The correct answer is peripheral artery disease. Question 136. Which of these is a violation of the Emergency Medical Treatment and Active Labor Act, Emergency Medical Treatment and Labor Act? Here are the options. Option A. Transferring a patient and sending the medical records electronically. Option B. Transferring a patient to a facility where the charge nurse is the accepting professional. Option C. Providing a medical screening examination 3 hours after arrival to the emergency department. Option D. Transferring an unstable patient to a facility that will provide a higher level of care. The correct answer is option B. Transferring a patient to a facility where the charge nurse is the accepting professional. The correct answer is transferring a patient to a facility where the charge nurse is the accepting professional. Question 137. A 15-year-old female presents to the emergency department with crampy left lower quadrant abdominal pain that lasted for 4 hours prior to arrival. She also is having frequent, severe, bloody diarrhea. What gastrointestinal disorder is she most likely experiencing? Here are the options. Option A. Ulcerative colitis. Option B. Diverticulitis. Option C. Crohn's disease. Option D. Appendicitis. The correct answer is option A. Ulcerative colitis. The correct answer is ulcerative colitis. Question 138. An adult presents to the emergency department complaining of a low-grade fever, malaise, pain in the joints, and headache for the past week. The patient reports hiking in wooded areas during a recent vacation in the Northeast United States. Upon physical assessment, a circular, flat, red rash with central clearing is noted to the left scapular area and local tenderness upon palpation to the left axillary lymph node. After confirmatory diagnosis, the emergency nurse anticipates which course of pharmacologic treatment? Here are the options. Option A. Levofloxacin. Option B. Doxycycline. Option C. Ceftriaxone. Option D. Praziquantel. The correct answer is option B. Doxycycline. The correct answer is doxycycline. Question 139. An adolescent patient who siphoned gasoline presents with coughing, vomiting, and decreased oxygen saturation. Which delayed sequela is most likely? Here are the options. Option A. Dysrhythmias. Option B. Seizure. Option C. Hepatotoxicity. Option D. Chemical pneumonitis. The correct answer is option D. Chemical pneumonitis. The correct answer is chemical pneumonitis. Question 140. Which eye condition requires bilateral patching of the eyes? Here are the options. Option A. Hyphema. Option B. Ruptured globe. Option C. Corneal ulcer. Option D. Keratitis. The correct answer is option B. Ruptured globe. The correct answer is ruptured globe. Question 141. An emergency nurse recently obtained specialty certification. Which category of lifelong learning includes this type of achievement? Here are the options. Option A. Professional development. Option B. Informal learning. Option C. Self-teaching. Option D. Problem-based learning. The correct answer is option A. Professional development. The correct answer is professional development. Question 142. Wolff-Parkinson-White is what type of dysrhythmia? Here are the options. Option A. Supraventricular. Option B. ventricular. Option C, junctional. Option D, heart block. The correct answer is option A, supraventricular. The correct answer is supraventricular. Question 143. Emergency medical services bring in a woman at 36 weeks gestation who has fallen from a balcony. The patient has no pulse and is not breathing. Chest compressions are in progress. What is highest priority for this patient? Here are the options. Option A, inserting 2 large-bore intravenous lines. Option B, placing the patient in the left lateral position. Option C, continue maternal resuscitation. Option D, obtaining fetal cardiac activity. The correct answer is option C, continue maternal resuscitation. The correct answer is continue maternal resuscitation. Question 144. When providing discharge instructions for a patient with gonorrhea, the nurse tells the patient. Here are the options. Option A, if the infection is still active when you go into labor, you may need a cesarean section. Option B, tell all sexual partners to seek evaluation and treatment. Option C, abstain from having sexual intercourse for 7 days after treatment has been completed. Option D, come back to the emergency department for follow-up treatment. The correct answer is option B. Tell all sexual partners to seek evaluation and treatment. The correct answer is tell all sexual partners to seek evaluation and treatment. Question 145. A patient presents to the emergency department after spending the past 3 days gardening. The chief complaint is chest pain. There is no shortness of breath, but breathing makes it hurt worse. Assessment reveals bilateral clear breath sounds, tenderness to palpation along the left sternal border. The 12-lead electrocardiogram and cardiac enzymes are within normal limits. What is the most likely treatment for this condition? Here are the options. Option A, nitroglycerin and aspirin. Option B, antibiotic therapy. Option C, corticosteroids. Option D, ibuprofen and heat. The correct answer is option D, ibuprofen and heat. The correct answer is ibuprofen and heat. Question 146. Distributive shock is best characterized by which of the following patient presentations? Here are the options. Option A, following a motor vehicle collision, a 20-year-old female has decreased sensation below the nipple line. Vital signs are blood pressure 80 and 50 millimeters of mercury, heart rate 54 beats per minute, respiratory rate 10 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 93% on 15 liters per minute via a non-rebreather mask. Option B, following a motor vehicle collision, a 45-year-old male suffered massive blood loss from a partially amputated leg. Vital signs are blood pressure 90 and 48 millimeters of mercury, heart rate 120 beats per minute, respiratory rate 24 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 96% without supplemental oxygen. Option C, a 36-year-old female with fatigue for 2 days presents with the following vital signs: blood pressure 89 and 45 millimeters of mercury, heart rate 190 beats per minute, respiratory rate 26 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 88% with 15 liters per minute via non-rebreather mask. Option D, a 20-year-old male with sudden onset of shortness of breath. His vital signs are blood pressure 104 and 70 millimeters of mercury, heart rate 96 beats per minute, respiratory rate 22 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, and oxygen saturation 97% with supplemental oxygen. The correct answer is option A. Following a motor vehicle collision, a 20-year-old female has decreased sensation below the nipple line. Vital signs are blood pressure 80 and 50 millimeters of mercury, heart rate 54 beats per minute, respiratory rate 10 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 93% on 15 liters per minute via non-rebreather mask. The correct answer is following a motor vehicle collision, a 20-year-old female has decreased sensation below the nipple line. Vital signs are blood pressure 80 and 50 millimeters of mercury, heart rate 54 beats per minute, respiratory rate 10 breaths per minute, T 36.7 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 93% on 15 liters per minute via non-rebreather mask. Question 147. A patient reports testicular swelling that he believes is due to physical activity. On physical exam, he is orthopneic, has dyspnea on exertion with a respiratory rate of 28 breaths per minute, and has 3+ pitting edema of bilateral lower extremities, scrotum, and abdomen. These findings are most consistent with which of the following conditions? Here are the options. Option A, heart failure. Option B, sexually transmitted infection. Option C, obesity. Option D, lymphedema. The correct answer is option A, heart failure. The correct answer is heart failure. Question 148. After exposure in a house fire, the patient presents to the emergency department with dyspnea and hoarse vocalization. Which condition does the nurse suspect? Here are the options. Option A, angioedema. Option B, pneumonia. Option C, asthma exacerbation. Option D, respiratory distress syndrome. The correct answer is option A, angioedema. The correct answer is angioedema. Question 149. A patient is brought to the emergency department following a motor vehicle collision in which the patient was ejected from the vehicle. He has obvious bruising on his sternum. He has muffled heart sounds, jugular venous distension, and low blood pressure. This group of clinical manifestations is also known as, here are the options. Option A, Cushing's triad. Option B, Kayer's sign. Option C, Beck's triad. Option D, Kussmaul's sign. The correct answer is option C, Beck's triad. The correct answer is Beck's triad. Question 150. A 40-year-old man presents to the emergency department with minimal urine output for the past 2 days. His history includes recent kidney stones. Which type of renal injury does this represent? Here are the options. Option A, intrarenal. Option B, intrinsic. Option C, prerenal. Option D, postrenal. The correct answer is option D, postrenal. The correct answer is postrenal.